Hi, everyone. Welcome to another session of Public Health 101. Today, we're going to be hearing about our asthma control program. So, Ashley, if you'd like to go ahead and take it away.
Sure. So my name is Ashley Fogarty, and I am the program manager of the Asthma Control Program. I'm just going to share my screen. I can. Okay. So I'm going to just briefly provide some background information about asthma as a condition, and then talk about some of the services that we provide at the health department. Um, okay. All right, so asthma is a chronic lung disease, and when people with asthma are exposed to triggers, their airways become inflamed and airway muscles tighten, making it difficult for them to breathe. A lot of people, when they hear about asthma, they don't consider it to be a serious condition, but it actually is, because if you have asthma and you end up having an asthma attack, you can actually die from that. And so it is really important for people who have asthma to know how to take care of their condition and understand when it has become an actual emergency, so that they know when to get help. And asthma doesn't go away. A lot of people will say, oh, I used to have asthma, not anymore. But it's a condition that it's like a lifelong condition, and it unfortunately cannot be cured. Once you develop asthma, you are likely to have it for your life. And even when you don't have symptoms, it's still there, and you can have a flare up. So some of the common symptoms of asthma are wheezing. So when you're breathing with a whistling sound, coughing, especially during the night or morning, having some chest tightness or chest pain, and shortness of breath. And so if you do have asthma symptoms, we recommend that you contact your doctor, and you can provide any family history, really listening to your breathing, considering your allergies, and looking for other signs of asthma. And so one of the major things that we try to promote as a program is using an asthma action plan, because an asthma action plan will basically lay out what to do when you have different asthma symptoms and when it becomes serious enough that you need to be taking your medications, either your controller medication or your rescue inhaler. And it is a really useful document. Typically, it is a document that parents can provide to any caregivers. Schools often will request these forms so that school nurses understand when a child needs their medication. And so asthma triggers are things that are caused by allergens, irritants, and aggravators. And so this is also part of an asthma action plan, because it really it helps a person understand what is going to exacerbate their asthma condition. So examples of allergens: dust mite, pests, pets, other animals, pollen, and mold. Irritants include things like smoke, aerosols, air pollution, pesticides. And then aggravators, it could be like if you have a cold. So during COVID, like the peak of it, we, as the Department of Health, we were getting a lot of, but I thought it would be good to show you because it provides a layout of the state showing different asthma hot spots. And so as you can see, looking at asthma claims in the core city area, they're a lot higher in those towns. And then on the right, you can see a breakdown of Providence and looking at the different neighborhoods, because Providence there's a lot of different areas of the city, like looking at the east side versus like South Providence and other parts of the city. It's very different. So I think it's just interesting to look at those different sections. So one of our primary programs is the Home Asthma Response Program, or HARP. HARP is a home visiting intervention that we have, and it uses a certified asthma educator and a community health worker to provide up to 3 intensive in-home visits, or because of COVID, we do also offer it virtually. So who is eligible? So this program is primarily for children. We are trying to open this up to adults, but right now our funding allows us to provide this intervention to kids with asthma. So it is meant for kids 2 to 17 who have severe asthma. So what does that mean? So we typically base our eligibility on healthcare utilization. So having 1 or more emergency department visits or an inpatient hospitalization for asthma within the past year. And so, this program is available to anyone, whether you have Medicaid or a private health insurance or no health insurance. Before COVID, we were, as you can see here, we were primarily focused just on the core cities, but like I had mentioned before, it includes all areas of the state. And so what happens with this program is that a family is provided with 3 intensive home visits, and this includes both education, and so they will receive an updated asthma action plan, so the family will understand how to manage the child's asthma, understanding how to use medications properly. That has been a really big thing that community health workers and asthma educators have noticed. Parents will get inhalers from the providers or the pharmacies, and they don't fully understand how to use them. So that is a major thing. And then also they will include an in-home assessment. So looking at things like maybe there's mold, there's pests, the family is using scented candles or other cleaning products that could be harmful to someone who has asthma. And then, so at the end of after completing the 3 sessions, they will do 2 follow-up calls. And so this just breaks down the program a little bit. So the program assesses patients' asthma knowledge and their exposure to different triggers. So, and everyone is different. Some people might be triggered by allergens, pests, tobacco smoke. Providing an intensive asthma self-management education, and then delivering cost-effective supplies to reduce home asthma triggers. So things like a HEPA vacuum, food containers, cleaning products that are asthma safe. So those are all things that come with the service. And then improving quality and experience of care. And so right now we are trying to get this program to be Medicaid reimbursable. And so we calculated that to provide this service to each family, it costs around $1,200 for each family to do the 3 full visits. And we have done a cost analysis and return on investment. And so this program actually has a positive return on investment. And so that is the major argument that we are bringing to Medicaid, saying, you know, it's costing more for these children to be going to the ED, going to the hospital, when we could provide this service and you're actually saving funds. And so some of the demonstrated outcomes of this program are quality improvement, improving asthma control, improved quality of life, reduction of environmental triggers, especially through the home, the assessments of the home, reduced missed school and work days, because that's a major thing. A lot of children are missing school because their asthma is poorly controlled. And then also likewise, parents are unable to go to work if their kid is sick. And then increased use of asthma action plans. One of our other programs, it is also home-based, but a little bit different, is called the Brevisia Home Project. And so this program is not as popular because it involves code enforcement going into a person's home. So a lot of people are turned off by that, but it is still an essential service that we do provide, because it really allows us to advocate for families who might feel like they aren't unable to advocate for themselves. So basically, Brevisia at Home is designed to work with families who are living in rental housing, and they have already received, a lot of them have already participated in HARP. They've received education. They understand how to use their medications properly. They have an updated asthma action plan, but their housing is still making their child sick. So we see this a lot in rentals where, you know, maybe the landlord is not fixing things. There's pests. The neighbors down the hall might be smoking tobacco, and it's affecting the child's asthma. So this program involves having code enforcement go into the home to identify any potential code violations. And so for eligibility, families with a child who has asthma, and then this program is just limited to the core cities for now. And then, like I said before, they must be renting their home or apartment. And so this is a screening that providers can use. So here's there's different things identified that could be causing an asthma related housing code violation. So like things like pests, like cockroaches, mice, maybe there are holes or in the exterior walls. There could be some moisture or ventilation issues or heating issues. And then so providers can actually refer through the DOH KidsNet program. And then we will get the referral, and code inspectors are also notified. So this program, like I said, is not as popular, but because of the issue with code enforcement, people get nervous, but it has been really effective working with public housing. Because if there are any code violations happening in public housing, rather than going through city code enforcement, I can work directly with facility managers of public housing units throughout the state. And so that has been really effective. And especially with Providence Housing Authority, they will send facilities management right to the apartment or the home, and they will fix everything. And then it's documented, and it typically goes very smoothly. One of our other services is called Cool It Off. And so this program is fairly new. We are on our third summer of providing it. And so it started during COVID because so high temperatures can exacerbate a person's asthma. And so during the peak of the pandemic, we are seeing that a lot of families were not really sure where to go if they didn't have air conditioners. Because typically they would go to places like the mall, the movies, other businesses like libraries, but a lot of things were closed. Even in public housing, different family rooms and big spaces were closed because of the pandemic. And so we worked, so the asthma program worked with the Alliance for Healthy Homes in Rhode Island, and that is also a great organization if anyone wants to get involved. So we worked with them to design a program to provide cooling assistance in the form of free air conditioners to households with a person who had asthma. And we primarily are focusing on people living in Providence Housing Authority. So any of the major public housing developments in Providence, but we have opened it up to other parts of the state. And it has been really effective. People have definitely appreciated it. And I know just this past weekend, we delivered, I think, like 13 air conditioners on Saturday. And so, yeah, I don't think there's a lot of states that are doing it, which is interesting, but it is one of those things that a lot of people, they don't consider, cooling to be associated with an asthma condition, but it all goes hand in hand. And I think it is something that I would like to continue to grow as a program. And lastly, so the Rhode Island Asthma Strategic Plan. So we developed a new strategic plan, which was meant to focus on asthma as a condition in the state and what we could be doing. So the purpose of the strategic plan, so it's an opportunity for cross collaboration and collective impact in how programs and organizations address asthma across the state. And so our plan was focused on 4 different priority areas. So we have housing, healthcare and systems, education systems and schools, and air quality and transportation. And within all of this, we have tried to connect every part to climate change. And asthma is an interesting health condition because it really is associated with all different areas. So like poor housing stock, older housing stock, that can affect someone's asthma. Looking at healthcare, so improving health outcomes and achieving health equity by increasing access to affordable and comprehensive asthma care for people in Rhode Island. Looking at schools, so connecting with school nurse teachers, making sure that schools are asthma safe, and that, you know, there's, for example, like good ventilation in schools. And then air quality is a major piece of everything, because, you know, air pollution or especially from traffic, construction, can definitely impact someone's asthma condition. And so this, I just thought it would be interesting to see all the different partners that we work with. Because I don't think people always consider how diverse asthma can be, because we, you know, there's so many different organizations in each of the different areas that really make up all of our stakeholders. And so I think that is one thing that I really enjoy about working with asthma, because it's so different. And then I quickly just wanted to touch on a funding opportunity that we recently applied for. So we applied for funding from the EPA, which proposed to measure the impact of air quality on asthma outcomes among 3 different communities in Providence. We will find out if we get the funding, I think this month or next month. So fingers crossed that we actually get it. So our proposal, so we propose to install air quality sensors to measure indoor and ambient outdoor particle pollution, so specifically PM 2.5. And then we are proposing to install air sensors within 3 public housing units in Providence. And so each of these developments are all family developments, because we are primarily pediatric focused, and all of these areas are located in close proximity to major highway systems. So here is a map, and this shows the 3 communities that we're focused on. So the 02909, 02907, and 02905 zip codes of Providence. So that's South Providence, Central, and West Elmwood. And because these were all, you know, they're close to highways, so there's a lot of traffic and construction in these areas causing poor air quality. And this also it breaks it down. And so these are 3 health equity zones and public housing units located in these communities. And then this just shows the health equity zones and then their exposure to the PM 2.5 particle pollution using the EPA's EJ screen tool, which is actually, it's very interesting. If anyone is looking into mapping or GIS, it's something that I highly recommend and we definitely use as a program a lot. So just a continued summary of the proposal. So we are proposing to work with the 3 health equity zones for a place-based approach within Central, South, and then West Elmwood communities. We are proposing to install 50 indoor air quality sensors across the 3 public housing developments, and then 20 indoor sensors across different community sites within those communities. And then 40 outdoor sensors across the public housing developments and different community spaces. And then another piece of this is that we're proposing to work with the Yale School of Public Health to calibrate these sensors and then develop a regional data dashboard and then map out all of this data. And then another major part of this is providing education and outreach to these communities and really advocating for them and providing them with the information so that they understand asthma, healthy housing, and air quality. And that is it. And here's my contact information. If anyone has any questions, you're interested to learn more about our programs. I know that was a lot of information in a short period of time, but feel free to reach out to me anytime if you would like to learn more. All right, thank you.
Thank you so much.